Did you know one of the most common antibiotics in the world actually kills bacteria by making them burst? Today we're going to explain how penicillin antibiotics like amoxicillin work inside your body. Antibiotics are among the most important discoveries in the history of medicine because they have saved millions of lives from infections that once killed people regularly. One of the most famous and widely used groups of antibiotics is the penicillin family. Medicines like amoxicillin and ampicillin are prescribed every day all over the world for infections ranging from sore throat and ear infections to pneumonia and urinary tract infections. Even though these medicines are extremely common, many people do not fully understand how they actually work inside the body. The truth is quite fascinating. These antibiotics do not simply slow down bacteria. Instead, they attack one of the most important structures that bacteria need to survive, their cell wall. Bacteria are surrounded by a strong protective wall that keeps their internal structure stable and protects them from the outside environment. Penicillin antibiotics interfere with the building of this wall. They bind to special bacterial enzymes called penicillin binding proteins, which are responsible for constructing the bacterial cell wall during growth and reproduction. When these enzymes are blocked, the wall cannot form properly. As a result, the bacterial structure becomes weak and unstable. Water and fluids begin to enter the bacterial cell, pressure builds inside, and eventually, the bacteria burst and die. Because these antibiotics directly kill bacteria rather than just stopping their growth, they are known as bactericidal antibiotics. This powerful mechanism explains why penicillin-type drugs have remained essential in modern medicine for decades. Penicillins are generally divided into two major groups: natural penicillins and semi-synthetic penicillins. Natural penicillins were the first forms discovered and include drugs such as penicillin G. However, over time, scientists noticed that many bacteria had become resistant to these older medicines. To overcome this problem, researchers modified the chemical structure of penicillin molecules to create new drugs that could fight a broader range of bacteria. These improved medicines are known as semi-synthetic penicillins. Among the most important of these are the extended-spectrum penicillins, which include amoxicillin and ampicillin. The term extended spectrum means that these antibiotics can attack a wider variety of bacteria than older penicillins. While early penicillins were mostly effective against gram-positive bacteria, extended-spectrum penicillins can also target certain gram-negative bacteria. This wider range makes them extremely valuable in treating common infections encountered in hospitals and clinics every day. Doctors rely on these medications because they are effective, generally safe, and relatively affordable compared to many newer antibiotics. Let's start with amoxicillin, which is probably one of the most commonly prescribed antibiotics worldwide. One reason for its popularity is its excellent absorption when taken by mouth. After swallowing an amoxicillin capsule or tablet, the medication travels through the stomach into the intestines, where it is absorbed efficiently into the bloodstream. Unlike some antibiotics that must be taken on an empty stomach, amoxicillin can usually be taken with or without food because food does not significantly affect its absorption. Once the drug enters the bloodstream, it is distributed throughout the body and reaches infected tissues such as the lungs, throat, ears, and urinary tract. The liver performs minimal metabolism on the drug, and most of it is eliminated by the kidneys through urine. In fact, approximately 70 to 80% of the drug leaves the body through the urine. The typical duration of action of amoxicillin is about 8 hours, which is why doctors often prescribe it to be taken 3 times per day. Its ability to reach many different tissues and its relatively long duration of action make it extremely useful for treating a wide range of infections. Now consider ampicillin, which is closely related to amoxicillin, but has some differences in how it is used clinically. Ampicillin can be administered both orally and intravenously. In hospital settings, doctors often give ampicillin through an intravenous line when treating serious infections, because this allows the medication to enter the bloodstream immediately and reach high concentrations quickly. One particularly important feature of ampicillin is that it can cross the blood-brain barrier, meaning it can enter the brain and spinal fluid. This makes it useful for treating certain infections of the central nervous system, including some forms of meningitis. Like amoxicillin, ampicillin is also eliminated mainly through the kidneys. However, its duration of action is shorter, usually around 4 to 6 hours. Because of this shorter duration, it often needs to be administered more frequently, sometimes 4 times per day. Despite this inconvenience, ampicillin remains an important antibiotic in many clinical situations because of its effectiveness against certain bacteria. Both amoxicillin and ampicillin are used to treat many different infections. These include ear infections, sinus infections, throat infections, bronchitis, pneumonia, urinary tract infections, and some skin infections. In children, amoxicillin is often the first-line treatment for bacterial ear infections. It is also commonly prescribed for bacterial sinusitis and throat infections caused by streptococcal bacteria. Additionally, amoxicillin is used as part of combination therapy for infections caused by the stomach bacterium Helicobacter pylori, which is associated with ulcers. Meanwhile, ampicillin plays an important role in treating infections caused by organisms such as Listeria monocytogenes, certain enterococci, and some gram-negative bacteria. It is often used in hospitals for more serious infections, including certain cases of meningitis and bloodstream infections. These antibiotics are also sometimes used to prevent infections before certain medical or dental procedures in patients who are at high risk of bacterial endocarditis. However, despite their usefulness, penicillin-type antibiotics face a major challenge: bacterial resistance. Over time, many bacteria have developed the ability to produce enzymes known as beta-lactamases. These enzymes can break the chemical structure of penicillin antibiotics and make them ineffective. When beta-lactamase enzymes destroy the beta-lactam ring of the antibiotic molecule, the drug can no longer bind to its target and therefore cannot kill the bacteria. To solve this problem, scientists developed special medications called beta-lactamase inhibitors. One of the most widely used of these inhibitors is clavulanic acid. This compound does not kill bacteria by itself, but it protects penicillin antibiotics from destruction. When clavulanic acid is combined with amoxicillin, it blocks the beta-lactamase enzymes produced by bacteria. This allows the antibiotic to remain active and continue killing bacteria that would otherwise resist treatment. The combination of amoxicillin and clavulanic acid is commonly prescribed for infections that are more difficult to treat, particularly respiratory tract infections. Like all medications, penicillin antibiotics can cause side effects. The most common side effects are related to the digestive system and may include nausea, vomiting, stomach discomfort, or diarrhea. These symptoms usually occur because antibiotics can disturb the normal balance of bacteria in the intestines. Some patients may also develop mild skin rashes or itching. In rare cases, more serious allergic reactions can occur. Penicillin allergies are well known in medicine and can range from mild rashes to severe reactions such as anaphylaxis. Because of this possibility, patients who have experienced serious allergic reactions to penicillin in the past should inform their doctors before taking these medications. Another rare but important complication associated with some antibiotics is pseudomembranous colitis, a severe form of diarrhea caused by the overgrowth of certain bacteria in the colon. Although uncommon, it highlights the importance of using antibiotics only when necessary and under medical supervision. Certain patients may need extra caution when using these medications. People with severe kidney disease may require dose adjustments because the drugs are eliminated primarily through the kidneys. If the kidneys cannot remove the medication efficiently, the drug may accumulate in the body and increase the risk of side effects. Doctors may also consider alternative treatments in patients with known severe penicillin allergies. In pregnant or breastfeeding women, These medications are generally considered relatively safe when used appropriately, but medical advice is always necessary before taking any medication during pregnancy or lactation. In conclusion, penicillin antibiotics such as Amoxicillin and Ampicillin remain essential tools in modern medicine. Their ability to destroy bacterial cell walls makes them powerful bactericidal agents capable of treating many common infections. Advances in pharmaceutical research have expanded their effectiveness through the development of extended-spectrum penicillins and the addition of beta-lactamase inhibitors like clavulanic acid. Despite the challenges posed by antibiotic resistance, these medications continue to save lives and improve health outcomes for millions of patients worldwide. However, responsible use is critical. Antibiotics should never be taken without proper medical guidance, and incomplete or unnecessary use can contribute to the development of resistant bacteria. Understanding how these medicines work helps patients appreciate their value and encourages safer, more responsible use in the fight against infectious diseases. If you found this video helpful, don't forget to like the video and subscribe for more simple medical explanations.